Hello, everybody. Dr. Coyle coming to you once again from the Coyle Institute. And today I would like to talk to you about something that I know is a major issue for many women. However, I also know that is something that is actually not reported enough to where people just aren't talking about it the way that they should. What am I talking about? I'm talking about painful intercourse or sexual dysfunction following a vaginal delivery. Oftentimes, during vaginal deliveries, there is also an episiotomy or a vaginal tear that accompanies the delivery of the baby. And without a doubt, we have some great research that shows the level of injury to the perineum, the area between the opening of the vagina and the anus, or the injury to the vagina itself, can be extrapolated out to the level of sexual dysfunction following that. So the worse the injury, obviously, the worse the sexual dysfunction. And so, oftentimes during a delivery, your provider may feel as though that they want to prevent you from having a tear, or they see that you could benefit from some more additional room. They make a surgical incision, and then obviously you have repair of that surgical incision or repair of that tear, and then the scar tissue that's left over can then lead to having painful intercourse or sometimes just pain in general. There are some women that develop a neuroma in this same area, and a neuroma is where you have injury to a nerve that gets kind of caught up into that scar tissue and can cause a lot of burning pain, pain with sitting, just pain in general. And so oftentimes the vaginal delivery, you guys have got a beautiful baby that's coming home with you, and you're so excited about that. However, because you have such significant discomfort in that area, it's hard to get back to normal relations with your partner. And so, what have we done about this? Trying to help women that have painful intercourse after a vaginal delivery with an episiotomy in the past. Well, we've had things where we just say, well, you've had surgery there, so let's give you what we call tincture of time, and that is just waiting to see if you get better. Clearly, there is some benefit to just kind of waiting to see if you can heal from things. We've also used some moisturizers, we've used creams, we've used physical therapy to try to loosen up the scar tissue in that area. We've used things like steroid injections into that area, actually all the way to surgery, to where we've had to take you to surgery and revise the scar tissue inside the vagina, kind of take that area out. I will tell you, obviously, surgery, when you take a scar out, there's always that possibility to where you can have the same or worse scar afterwards. There are ladies that if we think you have a neuroma, taking those out does seem to be very beneficial. And so those are the kinds of things that we've done in the past, gone from anywhere from having, just waiting to see if you get better all the way to surgery. Well, what do we have that's new? Well, the diVa Vaginal laser is absolutely something that is an amazing tool that we have. This was originally designed for women who are suffering from painful intercourse because of vaginal dryness. So women later in their years that their hormones have diminished to where they don't have enough hormonal support inside the vagina, their vagina becomes very dry, very cracked, very painful, very irritated, and so to try to have intercourse like that obviously is problematic. And so the vaginal laser was originally designed to try to rejuvenate or restore the vaginal tissue to a much more youthful state. Well, here at Coyle Institute, we've been using the vaginal laser for a long time, and obviously as a urogynecologist, we see all kinds of issues with ladies. And so one of the things that we wanted to do is say, well, what are some other things that we can do to help, that we can use this vaginal laser for? Well, we've known for over 20 years that lasers can significantly improve scar tissue. And so that's one of the things that said, all right, well, listen, if we've known that lasers can actually significantly improve scar tissue, and we know that the vaginal laser can bring a vagina to a much more youthful state, well, let's see if we can use it on some perineal scars and vaginal scar tissue. I can honestly tell you, without a doubt, we have significant success now with treating younger women that are recently delivered that are having painful intercourse because of that scar tissue, using the vaginal laser on the inside to treat the scar tissue on the inside, as well as using the same laser on the outside, on the perineum, to restore that perineal scar. Okay. In addition to that, a lot of ladies after having delivery will say they just don't feel like they did before. And so obviously at the same time of treating the perineal scar and the scar inside the vagina, we're also restoring the vagina to a much more, kind of pre-pregnancy state by tightening up the vaginal opening, by tightening up the vaginal tissue itself, restoring that. And so if you yourself, or if you know somebody that says, hey, I had my baby and things are going great, the baby's doing wonderful, but man, I just cannot get back to normal relations because it's just too painful. They may be suffering from scar tissue from an episiotomy or from a tear. And here at Coyle Institute, we can use our tools that we have, use the diVa Vaginal laser to really kind of restore that vagina. And you know what? That's one of our mission statement, right? Is we are restoring lives through improved pelvic health and try to get that vagina back to a much more youthful state, as well as pre-pregnancy state. So thank you so much for listening. We always are here to help. And if you are struggling, don't hesitate. Give us a call or go to coileinstitute.com and check us out online. Give us a call and we'll be happy to take care of you. So once again, from all of us here at Coyle Institute, have a wonderful, wonderful weekend, and we'll talk to you later.